Scott A510 is a non-toxic compound used in the treatment of various types of arthritis in the dog, cat, and horse. It can be used over a period of years without any adverse effects. We're now going to show you some case reports showing the effect of this compound on several dogs. The first one is a male German Shepherd, 13 years old, that came in the hospital completely paralyzed, could not walk. So we took an x-ray, and the animal had very severe hip dysplasia, as indicated by the shallow acetabulum, the erosion of the head of the femur, the calcification of the joint capsules, a very severe type of hip dysplasia. But since the owner would not let us do a myelogram on this dog to find out whether or not it was a degenerative myelopathy, we went ahead and treated him with the lysate. And as you can see, the only way this animal could get around was if the owner held the dog up by his tail. As soon as he let go of the tail, the dog would drop back down to the ground. After 3 days of treatment, this dog could walk on his own. He walked in a crouched position and walked with a great deal of difficulty, but at least he could walk on his own. Now, you can tell by the way he's panting that he's still in a lot of pain, but he's walking because the owner wants him to walk, and he's doing the best he can. This drug does not have any effect at all on degenerative myelopathy. So you have to differentiate between degenerative myelopathy and hip dysplasia. And a lot of times they have both of them. So you can produce some effects with the drug, but if they have both of them, it isn't 90 to 100% effective. After 21 days of treatment, you can see this dog was getting around quite well. He was wagging his tail and could trot. If he ran, he rabbit hopped, but at least he acts as though he's not having any pain now. This dog, after many months, is now running as well as any other dog, and it doesn't appear to have any hip disease, although obviously he still has it. The lysate appears to either slow down or stop the progression of dysplasia. This next dog is a 6-year-old German Shepherd with grade 4 hip dysplasia, very severe hip dysplasia, and was in a lot of pain. Would cry at night and cry when the dog had to get up and move, and wouldn't get in the car and wouldn't jump up upon things. And it was almost as severe as the first dog you saw. Now this dog could walk when it came in, but it walked with a characteristic dysplastic gait. As you can see, he walked with his hind legs tucked underneath him, and he walked with a kind of a wobbly gait and his legs close together. He also limped in his right hind leg. It's strange. In some cases, the dog's hips show a very severe dysplasia on x-ray, but clinically they don't show as much pain as you would suspect. After 15 days of treatment, this animal was getting around very well. He could run, and as you can see, he didn't have to be pulled on a leash to make run. Now again, as you can see, he's rabbit hopping, which is also characteristic of a severely dysplastic dog, but it indicates that he's relatively free of pain, but his degree of ankylosis in his hips prevent him from using each leg individually. But he's using them individually when he walks. His legs are still tucked underneath him to some degree, but they're not held as close together as they used to be. Now, this dog did not have to be coaxed to walk. He would walk and get around. It seemed to be a relatively happy dog. And he was conscious of his outside world. And as you can see, he can carry weight with one hind leg, where before he could not do that. Next dog is a 4-year-old beagle with calcification and luxation of the cervical vertebra. The calcification is up near in the atlas. This dog was in severe pain. We had to hospitalize him for about 4 days with Demerol, because he would scream with pain every time you touched him, and he couldn't move his head to one side or the other, or up and down, without just screaming with pain. And as you can see, he's panting a great deal, which is another indication of pain, and he's limping on his left front leg. If you'd let him stand, he would hold his leg up. He wouldn't put any weight down on it. If you made him walk, you had to make him walk with a harness, because if you put a leash around his neck, he'd scream with pain. He will walk towards the owner. We're trying to get him to walk away from the owner now, and he doesn't want to walk at all. He doesn't want to move. After 7 days of treatment, this animal showed a very substantial progress. You could use a leash around his neck, a choke collar around his neck, and he would pull against it, and without any apparent pain. Now, what the Scotty 510 does is gets rid of the inflammatory changes to start with, and then later on the fibrinoid changes, and when the fibrinoid changes are gone, the animal's able to move their body better, either their hips or their spine or their neck. And I think over a period of time we'll wear these calcified spurs down to some extent. There's nothing in the world that's going to get rid of calcified spurs without decalcifying the dog in other areas. This is a 5-year-old male German Shepherd with grade 4 hip dysplasia in his right hip. Showed quite a lot of pain. He walked with the characteristic gait, his legs close together, and he was limping on his right hind leg. He couldn't get up in the car, and he didn't want to jump, and he cried when he moved at night. It was hard for him to get comfortable when he tried to sleep. Now, this dog, although his dysplasia is not anywhere as near as severe as the first two, took a longer period of time to respond to the lysate. This is one of the reasons we put this dog in the series, is to show they don't all respond in the same degree. Some of them respond very dramatically, and some of them take quite a while to respond. This dog, as you can see, is limping on his right hind leg, and he's carrying his legs together with a kind of a wobbly gait. He's trying to put most of his weight on his front legs and not his back legs. After 72 days of treatment, this dog showed essentially normal movement in his hind legs. He could get around quite well and was relatively free of pain, although there was still some degree of clinical dysplasia. It's hard to see in this picture, but we could tell it as clinicians. In fact, the dog would get up and move around whenever he wanted to, and wherever the owner wanted to, but he was still walking with his gait, a little awkward gait. And we thought we'd try to see what this dog would do by walking on his hind legs, and as you can see here, he didn't want to walk on his hind legs. I don't know whether it was because our clinician tried to make him do it, or whether it really hurt him, because then we had the boy that owned the dog walking, and he would walk without too much resistance, although obviously he didn't like it too much. And this is 112 days after the treatment began, and by that time this animal showed complete remission of his disease. He was obviously alert to the outside world, and he could run and get around as though nothing was wrong with him. We keep these animals, a lot of them on it, for months and months and months. Sometimes we keep them on for 6 months and then try to take them off and see how they do. 75% of them can go without any further treatment. This is a female 4-year-old doxy with a luxated intervertebral disc. Most of these animals are referrals from other veterinarians. This animal was referred by another veterinarian following treatment for a while, and the owner did not want to do a surgery on her. I don't know if it was because of the cost or what, but she wanted to treat medically, so we took the dog in and treated her. We had to give her Demerol for 4 days because of the amount of pain she was in. She would try to bite at anybody that touched her. So we couldn't do anything with her for about 4 days, except we treated her and gave her Demerol. And after 4 days, we were able to bring her out and walk her around a little bit. But as you can see, her gait was stilted, and she didn't have very good control over her hind legs. And whenever you had her turn, she would fall down. She didn't have control over her hind end. She was beginning to, she was developing a fair amount of paralysis at this stage. 17 days after treatment, she showed considerable improvement. She would walk fairly fast, but however, she still had some stiffness in her gait, but you could turn her without her falling down. And she was in practically no pain at all at this time. "33 days after treatment, the dog appeared to be essentially normal and is normal now. Now, what we do is, I said just a while ago, is most of them we treat for about 6 months and then take them off the drug and see how they get along. And 75% of them we don't see again for maybe years. Every dog is a little bit different. Some of them have to have continuous treatment the rest of their life, and sometimes you cut it down to 1 or 2 shots a month. But each one of them is a little different, and you have to work with each one of them after the 6-month period is over. The owners don't seem to mind giving the shots. I run into a lot of people that said, "Oh gosh, I can't give those shots. It's impossible." But in 2 weeks, they're giving injections just as well as a veterinarian. Now, this dog is an unusual animal. She had very, very severe dysplasia and a spondylosis. You can see we couldn't even get her legs pulled down enough to get decent x-rays on her because of the ankylosis in her pelvis. But you can see the density involved around the area where the acetabulum and the head of the femur would fit in. She was almost completely ankylosed, probably about 10% functional joints on each side, and was paralyzed, or pretty near paralyzed, in her right hind leg. Her right foot would knuckle over. She couldn't get it to work right up for her. We had to pick her up to get her to move. And when she'd fall down, she couldn't get up again, so we'd have to get a hold of her and pick her up, and then she could move. But you'd have to almost hold her up to get her to get around. Now, these animals that are this bad, no drug is going to cure them. What the lysate does is get them free of pain and get them so they can get around. And over a period of 2 or 3 years, this animal will get around really well. But in the meantime, what you do is you get them well enough so that they're able to function properly. They're able to get up by themselves and they're in no pain. Now this animal was about as bad as you can get, but you do have to make them, you just have to use physiotherapy on them. You have to make them get up and move around, and it's a good idea to put them in a tub of water and try to get them to move their legs that way some, and get them to do some of their own exercise because they hurt so bad they don't want to move. After 29 days of treatment, this dog could walk on her own and she could get up by herself. She still showed some paralysis in her right hind leg, and her right leg did knuckle over, but when she got down, she could get up. She could get up by herself, as before she couldn't. Once she got up and got moving, since she would try to move faster, she would then rabbit hop, which is indicative of a lot less pain. Now, this animal is still having problems getting around, but is showing slow, gradual progress. But this animal will never respond the way another dysplastic dog would improve, that does have a free motion of the heads of the femur. After the calcification builds up far enough and they become ankylosed, it takes a long, long time. Now here she is doing her little rabbit hop. It took her about 6 weeks before we felt that she was relatively free of pain and could get around pretty well. Now, to teach the people how to inject this lysate is very important, because if you try to have them hold a syringe like people normally hold one, they mess it up. You have to clean off the cork of the bottle and then pull the lysate down into or the Scotty 510 down into the syringe. And then you pick up the skin with your left hand, if you're right-handed, and then with your right hand you hold the syringe like you're going to throw a dart, and then with your index finger push the plunger, and that gets the blister. Now my technician was left-handed, so she was holding the skin up with her right hand, and if you notice her little finger is up against the skin in such a way that both hands move in unison with the skin. Again, she's holding the skin as we suggested, and you can see her use her index finger to push the plunger. We're using this saline to demonstrate the effect. Now we inject up near the neck because it appears to have less pain there than it does in the flank or any place else, and so the owner has a better chance to give the injections.